Speaker, if we can have local resident Chris Kenyon up to the microphone, please. Thank you.
Good evening to you all on the sad occasion of Martin Jerome Roussel's passing away. My name is Chris Kenyon. I'm a local resident. I moved here in 1977. Went to Ambler Primary School in the north of here. I cycled every day to Highbury Grove, which is half a mile from here. And as an adult, I live just up in Angels with two children who are 8 and 9 who cycle every day, or every week in the borough, and two parents who are in their 70s who cycle every day in the borough. We are one of the densest boroughs in central London, and we should be a byword for active travel. And yet we are here again, marking an unnecessary, a predictable, a preventable death on our streets, not TfL streets, our borough, that we as residents take responsibility for. While cycling tracks are being built to the west of us in Camden, while Hackney ploughs ahead with filtered permeability and now curb-protected routes, while city workers get curb-protected routes to the south of this borough, Islington has become a byword for activity and not delivery, for spending money and not change when it comes to active travel. I've watched Cycle Islington engage with the councillors over the last 4 years, and it's become clear that this council lacks vision, is indecisive in making decisions, and is lackluster in actually delivering change on our streets.
Shame!
Okay, and I'll tell you now, as a Labour Party member, I am ashamed of what we are doing on active travel in this borough. I am ashamed. At its core, there is simply a lack of political will in the building behind me. And I am ashamed as a Labour Party member to say that with 47 councillors here, we lack political will around active travel.
Yeah.
Let me be clear, this council is a remarkable one. It is fighting savage central government cuts. It has been innovative around the Equality Commission, around the living wage. I'm proud of this borough for announcing on Monday that it will be the first living wage landlord in the country. And yet, Councillor Watts, the leader of the borough, has a paucity of ambition and lacklustre execution on this matter of active travel. And this is surprising to me, because the link between cycling infrastructure and social justice should be incredibly clear. You know, despite daily fare freezes, if you're a 16-year-old in the borough, a 1 and 2 zone travel card costs you £600. When you turn 18 as an apprentice in this borough, your travel card costs you £1,200. Cycling is simply the most cost-effective way of moving around the borough. And the question we have for Leader Watts is, should our roads be as safe for 18-year-old apprentices as they are for executives in Ubers? At its core, a protected cycle track is a profound statement of social justice. It means that we as a borough, as a Labour borough, are saying that a resident on a £100 bike is as valuable to the borough as a resident in a £10,000 car.
Yeah!
It is not a statement we can make right now. We talk about gender equality in this borough. If you look at Rachel Aldridge's extraordinary work around the Near Miss project, it is young women, predominantly in this borough, who feel aggressed by people in cars and on trucks. The only thing unpredictable about Jerome's death is that of the 5 deaths we've had on the King's Cross gyratory, he was the first man. This is a matter of gender equality as much as social justice. And then finally we come to the health issue. We face a health crisis based on inactivity, the like of which, an epidemic the like of which the NHS has not seen before. I have in my hand letters from Bart's Trust, St George's, King's and Imperial Hospital, each one of them calling for curb-protected tracks across the city. How can it be that councillors from the party of Aneurin Bevan, how can it be from a party that claims to be a trusted custodian of the NHS, how can it be that we are ignoring this clear advice about the health of our streets and the health of our community? It is the NHS as an employer that has lost more workers on London streets in collisions with bikes than any other employer in this city. You know, just October 2015, we have Julie Dinsdale, an NHS midwife, on our streets, hit by a left-turning Tesco van, an amputation. And here we are 24 months later with nothing, no public consultation. It is shameful. I am ashamed that we have not moved on this. This city changes all the time, and it is our duty, our solemn duty as residents, to make sure that change is for the better. I spoke about a year ago with many others of you, after the death of Ying Tao at Bank Junction, and that junction now is car-free and lorry-free every single day. The site of Janina Gellen's death at Farringdon Road is now the site of curb-protected tracks, and cycling is up 70%, and we haven't seen another cycling collision there. This is a great borough, and one that I'm proud to live in. Sadiq Khan has committed to tripling curb-protected tracks. Val Shawcross has secured a budget in the hundreds of millions of pounds for cycling infrastructure over the next 10 years. We expect Islington to take its commitment to social justice, to diversity in cycling and the NHS seriously. And we're clear, we demand that Islington works with TfL to make Old Street and Holloway Road and Camden Road safe for all. We demand that the quiet ways are taken seriously with traffic filtering and reduced space for on-street car storage. And we expect to see two-way access on every single one-way street in this borough. Okay. I call for this borough to become a beacon across London for social justice, and that we see safe cycling at the heart of that social justice and health agenda. Thank you.
Yay! Yay!
Thank you very much, Chris. Okay, next is Chair of the London Cycling Campaign, Terry